Today, we're going to talk about the ability to neutralize a pelvic obliquity or neutralize your pelvis if you're having a feeling when you step down, things are just off on one side. Oftentimes people talk about how their back hurts, then their hip, it translates all the way into their knee. When they come in for their consultation, we find out that they actually have an osteopathic lesion or a pelvic obliquity. That's a fancy term for something that means that your hips are not level. The pelvis is not level. If you place your hands underneath these little bones called the anterior superior iliac spine or the ASIS, I call them little hooky bones, then you may notice that one is tilted down. On the back side, that same one would be up. I'm going to show up from the side and I'm going to exaggerate, but oftentimes people have where one part of their pelvis is rotated forward. It almost brings things up like this. It can be from a very tight quadratus lumborum or really tight spasming muscles in the back. And as that tightens up, that's going to pull this hip up. Imagine then as you are striking down on your regular walking, this hip's going to strike first. And that's going to continue to shoot the vector of force all the way up through your knee, into your hip, and into your spine. So when I evaluate somebody for the first time in the office, they're complaining of knee, hip, or spine pain, I look at them, and it's looking at the bones standing and lying down. So let's do the one as if I've already done this in the office. I've told you that you have a right-sided pelvic obliquity. Most of the time it is right-sided, and it's not going to switch right and left on the same person. It's like that every single time you lay down and check yourself, it's going to be the same side. So this is my right side. I'm going to lay down, make sure you can still see my head and my feet. You're going to start laying down on a firm surface. You're going to bend the knees up, lift the hips up, put the hips down, bring the knees down. That's called neutralizing the pelvis. You're going to karate chop those hands, hook them under the ASIS, and slide those hands together to see if they are at the same level. If they're not at the same level, you treat the low level. So let's say it's the right side. That hand is going to be lower than, and they're not going to meet in the middle here. So that's the side we're going to treat. You treat it by bringing your knee into your chest. You want the knee to be in the sternum or the mid-chest bone, not over the nipple, not into the axilla, because what we're going to do is we're going to gap the sacrum, that triangle bone in the butt, so that we can then loosen the steering wheel with the PSIS, the ASIS, those little areas here, ischium there, and we can rotate. So the other important thing to believe is the vector or the way of the force that you're going to contract your quads. You're going to push that knee towards the junction between the ceiling and the wall. So that's going to be the force driver here. I'm going to reach underneath my hamstrings, not be on top of my shins. I'm going to reach both of them. My neck is neutral. My head is down. I'm not raising up. I'm going to bring that knee above or in line with the sternum, and I am going to contract my quads, not my hams, my quads. So as my quads contract, I'm going to drive that knee in the same force I said. So I'm going to contract for a count of 3. After that, I release and I exhale and I rotate my pelvis back towards my chest. So here goes. Push, 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 push. Exhale and pull. Push, 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 push. Exhale and pull. One more time. Push, push, push. Exhale and pull. I'm going to see if I neutralize myself. So we're going to bring the knees up, the hips up, the hips down. Take those knees down. Karate chop those hands. Place them underneath the ASIS hooky bones. Slide them together, and they are likely to be neutral. So because you're doing this yourself, you may actually have to do it twice. So it may entail doing 2 sets of 3 reps. And at that point, you should feel neutral. When you evaluate yourself, you should, laying down, feel that these bones are now equal. And you may get several hours to a full day of relief You sometimes feel that this is really already better on that one side. Other times you may have to do this every single morning, or after you've been working around for the day, walking around, you've been doing some stuff and you might start to feel that again. Lay down, neutralize your pelvis, check it out, see if you need to do one more set or 3 more reps or 2 more sets of 3 reps is 6. And you can slowly start getting that pelvis back into a neutral position and take some of that strain off your back, translating down the hips and into the knees. Thanks.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.